my name is Cynthia Krenzel-Doggett. I'm Assistant Professor of Music at Central College in Pella, Iowa. And I'd like to take a moment to talk to you about some fundamentals of clarinet playing that will help you create a better section in your band, will help with intonation and tone throughout the whole section. There are three fundamental things that I'd like to approach. And of those three, the most obvious, because it's external, is embouchure. So we'll be starting with embouchure, and I'll give you some basic ideas, what to look for, and also how to teach embouchure to your students. The most important concept to remember with the clarinet, of course, is that the sound is created by the vibration of a reed. So everything that's done in terms of embouchure is done to allow more vibration of the reed. In fact, I found that the problems with embouchure boil down to the embouchure getting in the way. That's what we don't want. We really want, in some ways, a neutral embouchure, but it takes a lot of muscles and practice to create that kind of neutral embouchure. Any extra pressure that's placed on the reed will affect the sound, generally in negative ways. One of the first things that I show to my students is the effect that pressure on the reed will have, and I do that by holding the mouthpiece up to a light source so that you can see where the reed and the mouthpiece come together. Do that, and you'll see that it comes together right about here, and you ask your student to place their finger where that point is. That is where you want the bottom lip pressure to be. The other thing I have them do is to take the finger, start at the base of the reed, and push gradually farther and farther up the reed, and ask them what they see. And what they'll see, and if you do this yourself, you'll see that the farther you get toward the tip, the more effect the finger pressure has on the reed. And if you're very close to the tip, you can close off the reed against the mouthpiece. And when you do that, the sound that you'll get, when you do that with your lips, you'll get a thin sound, a very quiet sound, and it will generally be sharp. And that's probably one of the more common things you'll find with young clarinet embouchures, is that students are taking in mouthpiece just at the tip. And so the bottom lip pressure is very high, which pinches off the reed and again leads to those things like being sharp and having a small sound, not being able to create a big forte. So quite often you have to encourage your students to take in more mouthpiece. And if you give them that visual cue, then they'll know when they go to practice. They'll be able to say, well, gee, am I taking enough in? Another thing I like to do is I encourage you to have your students all get mouthpiece patches. It helps cushion the top teeth, and then also you can cut a piece off the mouthpiece patch and put a ridge there if you want them to take more mouthpiece, then they have something to butt the teeth up against. But keeping that concept in mind, that the idea is to take pressure away from the reed, to let it vibrate freely. When you talk about basics of what to do with your lips, the most important thing to keep in mind is that you need to have a cushion in the bottom lip. Creating that cushion for the student, the easiest way I've found to teach it is to ask the student if they can whistle. And most of them can, not all of them, but if you whistle, you get sort of a drawstring embouchure, you get a cushion, and all those little lines in the bottom lip. And also, sometimes they will automatically make a beautiful clarinet embouchure. Not all the time, but you might get lucky, and it will be a flat chin, and you might even see a couple lines right here along the side. Some students can't whistle, and in that case I just say, well, pretend like you can whistle, or go, ooh, like you can embarrass them and tell them to pretend like they're kissing. But the point is that you get the corners in, and you get a cushion in the bottom lip. And that cushion will allow the reed to vibrate fully. And I will always have them use their fingers at first when working on embouchure, because putting the mouthpiece in it complicates things when they're first learning. So have them go ooh and feel this cushion, how much it gives. And then have them do this, pull the corners back and feel the difference. And the difference is it's night and day. Very hard, you feel the teeth, you can even feel the edge of the teeth, like this, versus corners in. Very cushiony and very soft. So that's what we want, because that softness allows the reed to vibrate. So think corners in, ooh, like whistling. And then with the bottom of the chin, I usually tell students to think about pulling the chin down and out, or down, point it to the ground, or pull it down and out. That's a more difficult concept for them to grasp. Sometimes at that point they will pull the actual jaw down, and you don't want them to do that. So if you find your student, when you say flatten out your chin or pull your chin down, if you find them opening the jaw, say, okay, no, wait, stop, and put your teeth together and try it again. Ooh, and then pull the chin down. And that helps them differentiate between the jaw bone and the muscles that are around it, the muscles of the chin, because obviously they're two separate things, but we rarely move them separately in normal life, but when we play the clarinet, we need to. So they keep the teeth together and go, ooh, pull the chin down. And that's basically the clarinet embouchure. The other thing that I want them to think about is using the top lip. It shouldn't just be neutral. That really should push down. And so I often have students use their thumb under their top teeth and then press down and feel those muscles in the top lip, because we don't think about them very much. So have them actually feel those. Once you get to the point where a student can, make their embouchure with the characteristics are the flat chin. Sometimes you get a line here, little lines in the lip, cushioning the lip. Then you can start to put the mouthpiece in the mouth. But I honestly stick with the whole using the fingers and things for until they start to feel comfortable with it. Okay, so then you have them do it in a multiple step process. Before they play any note, you have them in front of the mirror, looking at the embouchure they're creating so that they can visually recognize it, and also they can start to feel what it feels like. Then you have them take their mouthpiece, set the reed on the bottom lip, and then make room for the mouthpiece and pull the mouthpiece in. As you pull the mouthpiece in, a little bit of lip will come in with it, and that's okay. About half of the bottom lip will come in if you've got a good firm cushion. And you should get ideally a nice clear sound. But the problems you will see with embouchure at that point, especially when they might make a great embouchure in front of the mirror with their finger, they go to play, and everything just crumples because they don't have the muscular strength yet. So in order to gain the muscular strength, they need to work in front of the mirror, and they also need to reset the embouchure all the time. So every time they stop playing, to take a breath, to rest, or whatever the context, they need to take the clarinet out of their mouth. Think about the steps they need to make. Ooh with the lips, flatten the chin, set the mouthpiece on the lip, and then play. And they need to think about it in multiple steps for quite some time until it becomes a habit, and encourage them that it will become a habit, but the only way it's going to become a habit is if you do it over and over again. It's sort of the definition of a habit. They need to replace their old habit with a new one. So every time they stop playing, take the clarinet out of the mouth, reset the embouchure, and start playing again.